I may be a bit partial, but I think we make some amazing products. I don't know, does anyone want to practice without Serenia? Because I know I
No.
don't.
Oh man, I did. I did have the
Right?
opportunity to practice
Oh,
Yeah,
without Serenia,
fair.
and
Like, how would you walk through an owner to be like, okay, your pet has this, this, and this. It's probably time for Librela.
I love that question. What a good one. So you're like putting my feet to the fire. What would I do? I love that.
People at the end of the day are still going to do what they want to do.
Right.
But if you have all the information out there, what more can you do other than offer it? So I think this is another great way to do it.
Hello, everyone, and welcome to a special episode of the Veterinary Roundtable, the podcast where we answer your veterinary-related questions while having some fun along the way. If you enjoyed today's episode, be sure to leave us a review on your podcast provider of choice. And if you have any feedback to offer to improve the Veterinary Roundtable, let us know.
Don't forget to check out our social media channels. We have a TikTok and an Instagram. It's all at the Veterinary Roundtable. We also have a YouTube channel where our video podcasts are published, so you can head over there and watch us if you'd rather not just listen. We also have a text message feature where you can click a little link in your podcast provider of choice, and you can send us your questions through there if you'd like. You do have to leave your name, otherwise it comes through as anonymous. We also do take voice inquiries rather than just typing them, and it's much more fun because we get to hear you guys rather than us reading it in our blasé voices.
Yes.
So send us those our way, and we would be happy. And you also will play it on the podcast.
Yes.
So you can hear yourself on the podcast, which I think is pretty cool.
That's right.
That's
Like
very cool. Absolutely.
Well, who are you?
I'm Dr. Emily King.
I'm Courtney Allen.
I'm Dr. Ashlyn Duckwall, and I'll have the privilege of introducing our guest today. We're very excited. So she is a graduate of North Carolina State University, where she earned her undergraduate degree in animal science and her doctorate in veterinary medicine. She spent 12 years in small animal general practice before joining the team at Zoetis, where she is the medical lead for Canine Pain. She earned an MBA in 2022 and is a certified cat-friendly veterinarian. Please welcome Dr. Courtney Pierce to the Veterinary Roundtable.
Welcome.
Yay.
Thank you so much for having me. I'm so excited to chat with everyone.
Well, I've really been looking forward to this discussion because, I mean, as you know, there's just so much going on right now in terms of the loudest voice in the room with social media and all things Librela and Canine Pain and all those things. But before we get started, do we want to ask a few questions just about like Dr. Pierce's journey?
Yeah, no, that's what I think. It's really beneficial to our listeners as well as ourselves to get to know you. But I'm always curious. We're always curious. How did you go from general practice to landing in Zoetis? Like, what made you kind of decide that path for your career?
You know, that's a great question, and honestly, something I may still be trying to figure out. I think it was serendipitous to a degree. When I was early in my time as a general practitioner, I wound up doing some speaking for Pfizer at the time. So I would go to veterinary practices and really just share my experience about what I was doing in my general practice, and it seemed to go over pretty well. So I always had it in the back of my mind, like that was a fun experience. I really love clinical practice. I love my clients. I loved my patients, but I saw an opportunity to take a little bit of a career turn to the, I don't know, 180 degrees. And so when that opportunity presented itself, which was with a field position with Zoetis, ultimately that's what Pfizer Animal Health became, was what we are now, which is Zoetis. And I saw that opportunity, and it just fit kind of all my favorite things to do, which is talk with people, talk with veterinarians, and ultimately, and I hope I'm living up to this purpose every single day, improving the lives of the pets that I serve. So it's in a different way now. It's not direct patient care, but I still feel every day like I'm hopefully making a difference in a positive direction. And it's been an amazing journey. I've done some really exciting things, some things I never thought I would do, like a veterinary podcast.
Us too.
Yeah, right. So the journey continues, and it continues to fill my cup. So that's how I came to Zoetis. I think it was a little bit of luck, a little bit of keeping my eyes open for an opportunity, and I have to say it's an absolutely wonderful place to work for me. And I work with amazing people, and I may be a bit partial, but I think we make some amazing products. I don't know, does anyone want to practice without Cerenia? Because I know I don't.
No.
Oh man, I did. I did have the
Right?
opportunity to practice
Oh,
Yeah,
without Cerenia.
yeah.
And
fair, yeah.
were you started at like were you practicing like Cerenia was already a thing?
Oh,
I
yeah.
graduated.
When was that? When did Cerenia come out? I
Oh,
don't even
sorry. I
remember.
think it was 2007 or 8 because I
Oh
Way
worked
yeah.
after.
right when I graduated, and I was like, "Woo, no more time," doing whatever we did for vomiting pets when I worked
Oh my gosh. I could
in
tell you the
PR.
stories. I
We'll
this
have to
is this
circle
is
back to that
this
because I
is
would love
totally
to hear
making
about
me
that.
think of like
Yeah.
something in my head where we were graduating and it was like my first year out in practice and Frontline Fipronil came out and we thought it was going to revolutionize how we handled, and it did at the time. I mean, it was
Yeah.
like the big thing. And I remember going, "Oh my God, this is amazing." And now you look like, "Oh my God." Like, I mean, obviously it's been,
Look how
we won't
far
count how many
everything's
years,
come.
but it's been
Yeah.
enough years
Yeah.
that
What did you do without Cerenia?
That's what I was going
we
to ask.
did a lot of metoclopramide.
Mhm.
Oh, okay.
And oh my gosh, I'm drawing a
Zofran?
so
Did you do some
no, we didn't really use like,
Zofran?
I mean, we did, but it was more for like specialized cases.
Okay.
And
Famotidine?
why can't I think of the name, the drug that starts with a C that
Cisapride?
nope.
Some
We use it on,
editing?
yeah. Mm-hmm.
Yeah.
Okay.
Yep. Yeah.
Wow.
It was really just like,
So do you remember your first case of Cerenia and you're like,
I just remember being like, give this to me now. Like, I mean, it's just amazing. I mean, it's just
Yeah.
like changed so much of how you practice medicine.
it's, I mean, just like what you said, all your cool, amazing products, it's revolutionizing all
Yeah,
the time.
all the time.
Like so much has changed even the 6 years I've been out.
Yeah.
Well, not changed, but added to, I should say. But
Yeah.
I think your story is such an important and great example for our listeners. We have a lot of students that are in school, wanting to go to school, and it just is a great example of like you can literally do so much with our careers and with our with our education. So yeah, thanks for sharing that because there's some people out there who maybe, I don't know, maybe they haven't considered or thought about the various drug
Clinical
companies.
side.
Yeah.
How did you get into being the lead for Canine Pain?
Yeah, that's another journey that I'm on now. So I spent 5 years as what's called a field professional services veterinarian in the clinics, with clinics like All Star across my region. And then Zoetis is a company that's very supportive of development of its employees. So I got my MBA while I was working for Zoetis. That was my pandemic project. And it turned my focus to more of the business operations and the more sort of headquarters-based strategic approach that we take to medicine and product development and delivery and all of those things. And so I really just worked on enhancing my skills and seeing what opportunities were out there. And I was in a very supportive environment and have a really strong interest in pain management from when I was in veterinary school. I had the opportunity to work in a pain laboratory with cat and dog patients. And so that kind of charted my course. So when this role opened up, I went for it. And I have to admit, I thought, "Oh, this will never happen." And, here we are a year later, or more than a year later. So I've had really the pleasure and the opportunity of being we call it a medical lead. So it's really a medical facilitator of the, canine pain portfolio. So under my medical direction is, Librela and Rimadyl. So Rimadyl is, kind of the tried and true and been out there for a while. So it needs far less attention and support than Librela because most of us are pretty familiar with it. But I'm not doing this alone either. There's a large team around me of veterinarians and product experts and marketers. So I have one little corner of the world at Zoetis, but that's how it was through hard work and seeing what else was available at the company.
Excellent.
Cool.
Such an important corner, we may add,
Absolutely. A very
especially
important
being in
corner.
the
Yes.
practice.
Yes.
Okay, so let's get into
Yeah.
the nitty gritty.
Yeah.
Let's get into
we brought up the L word,
the
Librela,
L word.
so let's
That's
do
right.
it.
Exactly.
Okay, well, I guess we're setting the foundation, right?
Okay.
So why was Librela? Why did it even have to come to fruition? Well, goes to arthritis in our field. So I guess, can you kind of speak to, since that's kind of your niche, your role, like how, what is your foundation at Zoetis of the view of arthritis in pets, and how it's changes their lives, things like that, if
Yeah,
that makes
it's
sense.
it's a really important topic. So I'll start with prevalence just to set the stage. As you said, the statistic that we throw around a lot is that approximately 40% of both dogs and cats have clinical signs of osteoarthritis. If you think about that in a more practical number, it's 4 out of 10 patients. So think about that being in a veterinary clinic. If you saw 20 patients today, by the numbers, 8 of them have osteoarthritis. And then I always take it a step further and think to myself, was I diagnosing 8 patients a day with osteoarthritis on a full clinical day? The answer is probably no. So it underscores it's an incredibly common condition. It's also an incredibly painful condition. And, I'm probably preaching to the choir a little bit here, but we know that osteoarthritis is the most common type of arthritis in dogs. It happens when the normal protective tissues of the joint, like cartilage, break down, which results in um, bone on bone contact, lack of joint fluid lubrication, and ultimately it is painful and it leads to reduced range of motion, flexibility, and mobility of patients that are afflicted with the disease. So, in summary, it's very common, it's very painful, and unfortunately, it's underdiagnosed, and not just the veterinary team there that doesn't always get that diagnosis. It starts with owners recognizing it, which unfortunately we know doesn't happen as often as we would like either.
Yeah, I mean, I think that what we see in practice are owners who think that like crying out in pain is the pain signal, like is the signal, right? I mean, like how many times have we been in a room where
Yeah.
they're
I don't
like,
think they're
they're
in
like,
pain.
yeah, they're not in pain, they're just limping.
Right.
You're
Yes.
like,
They're limping because they're used to it.
right,
Yeah.
yeah, like
Yeah.
I mean, there's so many stories I have of owners
They're
doing those.
faking it.
They're faking it. I swear he just thinks that, yeah,
Yeah.
like so all these other reasons for the limping. And and they don't seem to draw the conclusion that, okay, hey, this may be something
Yeah.
like
What always
osteoarthritis.
gets me is the crepitus. Oh,
Yeah.
you pick up a knee or a stifle, whatever, and you just feel that crunching. And it's one of those where you just can't, unless you take the owner's hand, which I've never done. I don't know if you've done that or what, but you take their hand and put it on the knee, and like you feel that crunching.
Yeah.
That's the bone on bone. That's not okay.
Yeah.
I think it's really hard for them. Like, I think a lot of times too, the arthritis sets in obviously older ages. So a lot of that decreased flexibility and mobility gets lumped under they're just getting older.
Getting older. Yeah.
Which
Yeah, and
yes and no.
I think if I may too interject here at the risk again of preaching to the choir, it is certainly a diagnosis that we make later in life for the majority of cats and dogs. For dogs, which is kind of my lane at this point, the average age of diagnosis is right at 10.7. That's what we think of an older dog that's slowing down. But the research also tells us that dogs are affected much earlier than that. There was a clinical study up at NC State, which is my veterinary college, so point of pride there. But it looked at pets between 8 months and 4 years of age, and nearly 24% between 8 months and 4 years of age had clinical signs of osteoarthritis.
Was
And
that Oh, sorry.
go ahead. Yeah.
Was that breed specific or was it just
It was
anybody
all
or any
breed.
dog?
It was over 100 patients in the study, so not a small number of patients. And they were evaluated by really skilled practitioners, both radiographically and physical exam wise. And to get a diagnosis of clinical arthritis, they had to have both radiographic and physical exam changes. And so the other really compelling takeaway from that study is that only 2 of those dogs were getting analgesia
Oh,
out
wow.
of
Wow.
uh,
Wow.
and so it just speaks to pet parents, caretakers don't recognize, and I'll put myself in that category. I didn't diagnose osteoarthritis pain that early in life, but if we think about why it happens because dogs have conformational abnormalities present at birth, and those compound over time. Early in life, they tend to like adapt to those painful changes. You might notice the change
Oh,
in
yeah.
gait.
Mhm.
Later in life, you almost can't miss it, right? But
Yeah, I
early
mean,
in life, it can be very subtle.
you can have those dogs who have elbow dysplasia
Oh,
and
yeah.
who sit in a room,
Yeah.
sit in the exam room, and they sit a certain way. And so you're like, okay, this range of motion is not going to be normal on this
Yes.
dog.
Yeah.
But yet the dog, per the owner, is not clinical.
Yeah.
To your point of they just kind of accommodate and they
Yeah.
grow up thinking that that's what's normal for them.
Yeah, we
Like the
diagnosed
dog
Miles
thinks
with
that's
it,
what's normal for
and
them.
he's fine. Like right now, I wouldn't think he was anything was wrong
Right.
with him.
Right.
Yeah.
Plus, I think there's all these other risk factors too for
Mhm.
dogs
Mhm.
as they're aging. So you have those heavy exercise dogs, like the agility dogs,
Yep.
and you have dogs that are overweight. And then you have, like, there's all these other things that are contributing to the formation
Absolutely.
or predisposing them, I guess, to
Yeah.
osteoarthritis as well.
Yeah.
Mhm.
Yeah. It's actually a much more intricate topic, I think, than what's led on,
Oh, for sure.
especially towards like in an owner's mind where
Mhm.
they may not necessarily see it themselves.
Or like
So,
if you told them if their dog was 2 years old and you're like, that your dog has arthritis.
Mhm.
No, it doesn't. It's too
Right.
young to have it because, and I feel like in people most of the time, it's
Yeah.
when you're older, unless you have like a genetic whatever predisposition. But I feel like if you told an owner that, they would look at you like you were crazy.
So we've
Yeah.
had, Riverdale's probably older than you guys.
yeah, I've had access to that the whole time.
So, I
Well, I'm
mean,
a baby.
Riverdale, when was it launched? 1997?
57, yes.
It was
Seven?
released
So,
before I was.
when were
I
you
was
born?
5 years old.
Okay, 5.
I was born in '99, so
Okay.
I wasn't even born
Okay,
yet.
because sometimes I'm like, it's older than the people in the room.
Mhm.
So we've had an NSAID, and then there's been other NSAIDs all these years. So now we have a new actor, on the playing field,
Mhm.
which is Silencia for cats and then Librela for dogs. So why don't you talk a little bit about, Librela, its mechanism of action, that kind of thing.
Yeah, I would be happy to. And you pointed out that Librela is the canine anti-NGF monoclonal antibody. Its feline counterpart is Solensia, so anti-NGF monoclonal antibody specific to cats. Librela is a once monthly injectable product, and it targets NGF. And by doing so, it controls the pain associated with osteoarthritis. So I think it's important once we talk about what is the mechanism of action, if I may, let's talk about what NGF does to signal pain and contribute to both the pain and inflammation associated with osteoarthritis. Um, Most of us were trained in vet school. Maybe some of the newer grads learned about NGF during vet school. I can tell you, I did not.
I
Most
don't
of us
remember.
learned about prostaglandins being a target for pain relief for pets with osteoarthritis. And that's where all of our nonsteroidal anti-inflammatories work. They target prostaglandin pathways. Well, much like the prostaglandin pathway, which contributes to pain and inflammation, nerve growth factor is an important signaling molecule, so it's a chemical messenger, and it communicates both the pain to the patient and then sensitizes nerves further, so that they're more prone to feeling pain and communicating pain. So we'll go back to kind of how does pain start in an arthritic joint? Well, NGF as well as other chemical mediators are released from damaged tissues. So think about your patient who has poor conformation in their hips. Pretty soon those hips are going to be, moving abnormally and causing disruption in that cartilaginous layer, and NGF is produced or released from those damaged tissues. And so this is a little heavy science, but bear with me. I think if we paint some analogies, we'll understand it. So NGF is released, and it's like a fire alarm going off. Once NGF is released, it finds its receptor. That receptor is called TrkA, and that receptor lives on the end of nerve fibers. So all of a sudden, this fire alarm has been pulled, and now, like, the fire engine is leaving the station. NGF binds to its receptor on the end of that sensory nerve, and then that signal, that fire engine, travels up the spinal cord and communicates with the central nervous system. Now, it's a little bit of an oversimplification, but essentially it results in an alteration of those nerves. So, both peripherally, so in the joint, and then also centrally, the central nervous system. And I think many of us have heard this term central sensitization, and that's also referred to as wind up, where like a normal average stimulus then creates an abnormal or overexcited response. And so NGF is a messenger that can trigger that cascade of the periphery being sensitive and the central nervous system being wound up. And then NGF, I always say, is kind of like that person you didn't want at your party. Like they come in, they start wrecking stuff. You ask them to leave. They're like, no, no, no. Like I'm going to do more here. So NGF not only does it sensitize the nervous system, but then it causes additional release of pro-inflammatory mediators, including more of itself. It like invites its friends to the party, and it gets worse and worse and worse. And so then we have further central sensitization, further peripheral sensitization, release of inflammatory mediators, more release of NGF. So you can see how then, as Librela and Solensia act by binding NGF, removing some of it from circulation, it can't do all those things. It's like the bouncer at the party. It's like, all right, come with me. Like you've overstayed your welcome. You're causing a lot of problems. We're going to get you out of here. And then that process can quiet down and return that pet to a more normal, pain-free state. So tell me what questions you have.
Wow, that was a great explanation.
Yeah, great
Fire
explanation.
truck,
Wow.
Everyone
burning.
can relate.
Yeah.
That's awesome.
Yeah.
I appreciate that.
I think some
Sure.
of the not conflict, I don't know what the right word is. Some of the worry came from people thinking that it's binding all NGF. And I think that for me it was important, and correct me if I'm wrong, but it was important for me to understand that it's binding excess NGF.
Yeah,
So it's
I
not
think-
like it lowers it like down to zero, correct? Am I right about that?
Yeah, you are right about that, Dr. King. And I'm with you. I think it's a really important point. So the dosage of Librela was crafted and formulated with numerous laboratory studies. And it was never the intent to bind all NGF. The dose of benvetmab, which is Librela, reduces NGF, but it doesn't completely eliminate it. I think it's also important to remind your audience that NGF is produced in abundance by arthritic joints. So by definition, patients with osteoarthritis have excess NGF, and that's well documented by research. It's also the case, too, that the function of NGF is largely in development stages of immature animals, so prior to full maturity, before a year of age, which is why we don't use Librela or Solensia in pets under a year of age. But once they are mature, the majority of NGF, what it does is pro-pain causing or pro-nociceptive. So if we can reduce it to a more, kind of homeostatic level, then we reduce pain without completely eliminating NGF. So thank you for highlighting that. I do think it's a really important concept for us as veterinary healthcare team members to understand and be able to communicate to pet owners.
And I think, I might be jumping ahead a little bit here, but so a lot of that pathway involves the nervous system, right? There's a lot of nerve talk there. So a lot of the worry that I hear or, you come across is more in the neurologist's realm. So can you, I guess, speak to that or try to make people feel better about that? Like how would you approach it with an arthritic dog, but also a potential neurologic dog at the same time, and then make that decision?
Yeah, that's a really important question. I would say it is one of the most common questions I'm asked and my colleagues at Zoetis are asked. So thank you for posing it here. So let's start with NGF. It is nerve growth factor. As I mentioned, it's primarily responsible for development of the nervous system in immature animals. Once animals mature, it's primarily a pain signal. However, you brought up this case of an animal who has osteoarthritis and possibly an underlying neurologic disorder. And I would say it's so common that those two patients overlap. We talked about average age of diagnosis being about 10.7, and I think the statistic is for geriatric animals above about the age of 12, it's around 15% have a neurologic disorder. So those two populations overlap like crazy. So I would say first and foremost, it is really important to do a full orthopedic and neurologic screening of our patients. That seems obvious, but I know in practice it's not that easy to fit these things in sometimes among all the other things we have to do. But in reality, doing an ortho neuro screen can be quick and efficient. And we do have some resources created by Zoetis, supported by Zoetis that we can, share with you. Maybe you can include them in the show notes that can help, kind of retrain us as practitioners or remind us to do that. So that's first and foremost, establishing a diagnosis. The second thing to keep in mind is that having an open conversation with a pet owner about expected risk and expected benefit with any medication is so important. All medications carry a risk of adverse events, and Librela is no different. So, having a conversation with owners about what you're recommending, what the benefits are, which for Librela is control of OA pain, and what potential risks may be, which is to say, oftentimes underlying neurologic abnormalities are yet to be diagnosed or not diagnosed. And so, what we're seeing with reports of neurologic adverse events in patients receiving Librela oftentimes is a correlated event, meaning it happened around the time of administration of Librela, but not necessarily causal, meaning product causing adverse event. We can get a little deeper into that. Um, Other things to consider about Librela, I mentioned it binds to TrkA, which is its receptor. TrkA is largely found almost exclusively on sensory nerves, and that is the preferred receptor for Librela. So sensory nerves versus motor nerves. So it kind of begs the question of, well, if there aren't TrkA receptors on motor nerves, then that's not where Librela is having its action. And then I'll say finally, and certainly see what follow-up questions you have. Monoclonal antibodies are very large molecules. So compared to a traditional small molecule pharmaceutical, monoclonal antibodies are pretty big, very large, comparatively speaking. And they, under normal circumstances, with an intact blood-brain barrier, won't cross into the central nervous system. So when you think about reports of central nervous disorders associated with Librela, even in studies looking to allow monoclonal antibodies to cross the blood-brain barrier, it can be really challenging to make that happen. So thinking about the potential mechanism of action there, again, with an intact blood-brain barrier, it would be unlikely, if not very, very challenging for a monoclonal antibody to pass into that central nervous space. So I'll pause there and see what questions you have, because there's a lot to unpack with that one.
I think that if you're so, I just want to make sure I'm digesting this correctly.
Yeah.
The TrkA is on sensory nerves, and then which is where Librela likes to go. And so we're saying that if you have motor dysfunction, if you give Librela and you see motor dysfunction, loss of proprioception, or like, how are you ataxia? Are you classifying those things as potentially like a motor dysfunction showing up? Which then you'd be saying to yourself, well, it's unlikely that it's Librela because this molecule doesn't bind to the motor nerves. The nerves responsible for motor function, I guess is what I'm saying.
Yeah, and I think what would be helpful here is to consider it's where the primary receptor for nerve growth factor is. There are other alternate, less preferred receptors that can be present on motor nerves, so I certainly don't want to rule out or speak to any individual case. I think what is helpful here is to consider that the rate of neurologic adverse events associated with the administration of Librela, though oftentimes get a lot of attention, the actual rates are low, so they're considered rare, between 1 and 10 per 10,000 doses distributed. animals could or have reported an adverse event of a neurologic nature. So that's a pretty low rate of adverse event. And certainly we're not, or I should say in the positive, we're talking about 30 million doses or more in the market over almost coming up on 5 years of global distribution of Librela, and the rate of adverse events of a neurologic nature remain rare, 1 to 10 per 10,000 doses distributed.
And isn't the one that everybody is talking about as far as ataxia, isn't it like, when I was looking it up, it's like 1.4 cases per 10,000?
Yeah, it's
I mean, it's so
low. I'd
small.
have to, yeah, it's low if we look specifically at ataxia. Though I will say, Dr. King, if we look at the most common adverse events reported with Librela, to be clear, number one is actually lack of efficacy.
Yeah.
Yeah, and then we have ataxia and polydipsia, polyuria. So and that's on a global basis. So yeah, you're right. It's in low number. I'd have to get you the specific decimal point, but it's a low rate between 1 and 10 per 10,000.
So with such a low rate, does it prompt like the, I guess, Librela team creation, whatever, to then look into it directly associated with specific neurologic diseases? Or is it something where it's such a low rate that it's more or less hard to prove that it's a part of the drug itself or a side effect of the drug itself?
Yeah, so I want to make sure I have your question, or that I heard your question correctly. Is that is Zoetis evaluating potential adverse events of a neurologic nature? Yeah, and I can say resoundingly, absolutely. We take all adverse events seriously. We are doing further investigation for any adverse events that are reported to us, but particularly those of a neurologic nature. We have a number of both internal and external experts that are looking at adverse events and really overall aiming to better understand the safety profile of Librela, and not just Librela, all of the products that we have in the market. That is a goal of Zoetis, to better understand the safety profile so that we can understand as a profession the best way to use these drugs to benefit our patients.
Are there any, I don't recall, there's no listed contraindications, correct?
Contraindications would be pets under a year of age,
Okay,
those that are pregnant, breeding, or lactating, because we have a developing nervous system, and then certainly any pets that have had a hypersensitivity reaction to the pet before. But yeah, those are the only ones.
Okay. That's good.
Yeah.
What would you say? We have a neurologist who is a friend of the podcast, right? And so he has, he is, and he would kill us if we did not ask, this question. I don't think that he thinks that Librela's lived up to its expectation. He probably is seeing some of these, cases that, have not responded to Librela, or maybe have unmasked something potentially. His concern is, what would you say, about Librela and its approval process and how it was approved and what that process looked like? Because I think we need to correct the narrative from that perspective, from the standpoint of thinking that, okay, it didn't undergo the right amount of studies, or it doesn't have the right backing in order to be approved. Can you address some of that for anybody that might have those concerns?
I really appreciate the opportunity to address that, because Zoetis, like all animal health manufacturers, we adhere to quite robust and rigorous processes of approval, not just in the United States, but with multiple regulatory agencies across the globe. So in the US, we have the FDA, but we also work with the EMA and the Canadian health authorities. And in the process of having a drug approved, we do adhere to all of the rigorous requirements for research, for clinical trials, for field trials. And in the case of Librela, there were numerous pre-approval studies done, both to evaluate the efficacy and the safety of Librela. So it's certainly not one study. Now, I do want to be clear, though, because in terms of safety of a medication, the pre-approval process is incredibly important. That's where we have well-controlled studies, typically, double-blind, placebo-controlled. We have laboratory studies that evaluate a target animal safety or sort of the dose tolerance. We have a number of rigorous studies that adhere to regulations, but it doesn't stop there. Once a product is approved, we don't stop looking at the safety profile of it. And with Librela, in fact, that process called pharmacovigilance, where we monitor the safety of a drug once it gets into the target population, that process has been ongoing since the day we launched Librela. And a study evaluating that data was recently peer-reviewed and published, which I want to make a note is kind of an unusual step. I don't know that I fully understood that, but not many animal health manufacturers release the entirety of their data to the public, which is essentially what we did. And so anybody that's interested can look at that publication. It's available open access on Frontiers of Veterinary Medicine. And it looks at adverse event reporting for 17 million doses in the market. And that's some of the data that I shared with you. So we absolutely adhere to all regulatory requirements before approval. And then the process continues after approval. The key differentiator here is that when you study a product in hundreds of laboratory animals and hundreds of field study patients, you certainly have a little bit more controlled conditions. Once the product is in the market, it's you're not controlling the conditions anymore. These are real dogs living real lives. And that's when we really start to see the safety profile. And I can confidently say that for Librela, with over 30 million doses in the market, we continue to see that all adverse events are rare and that the safety profile is what we expected. No medication is without the risk of adverse events, and Librela is no different. However, the safety profile continues to be what we expected, and it's performing well in patients.
So why, having all that information, the study, all the information access out there, like, why are people having such a hoopla about Librela instead of Solensia when it's correct? I mean, they perform the exact same way, correct? Just the different species they're focused on.
Yeah, it's a great call out because it is the same mechanism of action. But I think the other thing you said is really important too. They are different species. We've heard some, I think, along with your last question, Dr. King, about pre-approval studies and what about these types of products in humans. Well, it's important to recognize that these products are species specific. And so Librela is specifically a canine monoclonal antibody, Solensia, a feline monoclonal antibody. And we can't extrapolate always from other species what will happen in the species we're studying. As far as why Librela has gotten a lot more attention as a really strong cat person, it hurts my little heart to say that I think some of it is that we know feline patients are largely under medicalized as a species. I think the data tells us it's something like 65 million cats are out there living in U.S. Households, but only about 24 million visit the vet.
Wow.
So they're not getting quite the same attention as dogs,
That's a
which
big percentage,
again, hurts my heart. And while it's the statistics for cats are a little more shocking, over 6 years of age, almost 60% of them are affected by OA. We only bring up, as a profession, osteoarthritis in about 20% of cat visits. So I don't know that I have all the answers for you, but I do think it has to do with a difference in the attention that we pay to the feline species, a little bit in the difference of how they interact with us. They're much better at hiding pain. Yeah. So there's probably a lot of factors there, but I know at least for cats, they unfortunately, good or bad, don't get the attention that they deserve.
Yeah. I also feel like in the clinic setting, doing a true, like, really good, like just exam with cats, like range of motion, all of that kind of stuff is so difficult.
Yeah.
And then when they're sedated, I mean, that doesn't work.
Yeah.
And so I feel like really palpating the pain in the clinic is very difficult on cats, especially. I mean, some dogs, but I feel like cats, it's very, very hard to get a good exam done on them.
You are
So then I feel like stuff
not
is
alone in that
missed.
struggle. Yeah.
I
You are
rely heavily
absolutely not.
on what the owners see at home. And
Yeah.
even then, it has to be taken somewhat with a grain of salt because I don't know. Do they necessarily know what they're looking for? I don't know. But yeah.
Yeah.
It's a
Yeah.
hard one.
You know, can you speak to the challenge that has been thrown out there with the arthropathy and the progression or the, I don't know, accusing of rapid progression of osteoarthritis in canines and trying to compare it to humans with progressive, you know, rapid arthritis and like the difference? And because I think when I learned some aspects of that, that also helped me be like, oh, okay.
Yeah.
We may not know, like there may be, an undiagnosed classification of an arthropathy that we don't know about, but, you know, can you talk a little bit about that and how and address that? Because I think that's of concern to a lot of people.
Yeah, I agree, Dr. King. That is probably the second most common question that I get asked. So I appreciate you asking it and bringing it up. And if it's okay with you, I think it may be worthwhile just to level set a little bit about, what is RPOA, what is what is progressive arthritis, because I think while many of us have heard this, some of us may not. And RPOA stands for rapidly progressive osteoarthritis. And it is a condition that has been clinically classified in humans since the 1950s, long before we had monoclonal antibodies of an anti-NGF nature. So it is a condition that's been diagnosed on the human side. And I make a really important point of clarification here. They almost couldn't have picked a worse name because it's called rapidly progressive osteoarthritis, which would make you think, oh, it's arthritis that progresses more quickly. Like,
Right.
Yeah,
Yes.
it makes sense. I mean, those words make sense. That's the definition of those
Yes.
words.
and it's interesting because it's actually not just osteoarthritis that goes faster than we expect it to. It's its own condition. So maybe as I don't know, dream about the world the way I would want it to be, it would have a different name to keep it straight for everybody. But I think it's an important call out. It's its own destructive arthropathy. It is not osteoarthritis that just went a little faster. In humans, osteoarthritis does progress at different rates, and it's very well documented that a certain percentage will progress mild, moderate, or quickly. We don't have that same information in canine patients. And so, as far as RPOA in canine patients, still, and this is I think it's an important point, and I don't want to belabor it, but it still has not been characterized in canine patients. So, like you said, Dr. King, we certainly don't exclude the possibility that there is a yet to be characterized arthropathy in canine patients. But we are still looking to understand better what that is, what factors may contribute to it. And at this time, as we look at, I've referenced the data quite a bit here of pharmacovigilance or post-approval surveillance, the rates of musculoskeletal adverse events remain rare with Librela, and that's with 30 million doses distributed in the market. So we don't have that same information about what normal rates of progression of osteoarthritis are in canine patients. We are working to better understand that. But it makes it hard to say, okay, so this one is different than anything I've seen before. It's not impossible, and I think the knowledge is progressing and we will understand more in the future. But I think it's important to level set and really consider the rate of risk and the rate of occurrence being rare. So 1 to 10 per 10,000 animals having a musculoskeletal adverse event overall, and certainly a much lower percent where we have concern for some abnormal progression. Is that helpful?
Yeah, that's very
Yeah.
helpful. Yeah, I think so.
Yeah, I think for me it was just like we don't even know what's normal.
That's what I was just
Like,
gonna
so
say.
how
Is
are
I
we
don't think
supposed
it's
to say
fair.
that? Yeah.
Yeah.
Yeah, and I will, like, maybe gratuitously share that one of the things I really enjoy about my job at Zoetis is that not only do we fund research for our products, but we fund a lot of research after approval. We partner with academic institutions and private veterinarians to better understand the science about many things, but in this case particularly, we've partnered with an academic institution to answer questions just like this, and it's exciting in a way because we're expanding the body of knowledge about a topic that's really important. So it's one of the fun parts of my job.
Yeah, that's
Absolutely.
awesome. So can you then speak to then just the Dear DVM letters, especially the one regarding Librela, I guess the intention behind that, and how it came to be, things like that.
Yeah, there was a Dear DVM letter that was issued by the FDA. I believe it was last December. And the FDA does review post approval experiences, so post approval safety data, as a very standard process. So they do that routinely. So the communication that was issued to veterinarians was not a warning letter. And I've actually heard that phrase used. I've seen it in print. And it was a mischaracterization of what the FDA letter was. It was a communication to inform and educate both pet owners and veterinary professionals about treatment with Librela. So they were sharing data that they had evaluated after the launch of Librela in the US market. So it was not a warning letter, it was a letter to inform veterinarians of an update, which is a normal part of the post-approval process for any product. And, an interesting activity would be to go to the FDA website and search for Dear Veterinarian letters. They're not unusual. They have happened with other products, and they are distinctly different from a warning letter. I'm no FDA expert, certainly, nor do I aim to be, but they are two very different things. And in the case of Librela, it was meant to educate and inform so that veterinarians could help their pet caretakers make good decisions and when it comes to treatment.
So does Zoetis know that those letters are being formed, or is that just FDA doing their own thing?
Yeah, we do have communication with regulatory bodies. We communicate about a number of things, whether it's safety updates or new product applications. But I think the short answer is we don't always know exactly when those are going to be issued. The FDA does have the ability to do that when they want to, so we don't always have a heads up
Yeah.
for that. But again, it's a normal part of post approval drug lifespan, and so it's certainly not unexpected for a company like Zoetis or any
Okay.
other animal health manufacturer.
Sure.
Interesting.
Mhm.
So, in regards to the letter, like informing obviously veterinarians as well as pet owners about Librela and the science behind it and whatnot, how would you like if you had to give a checklist to an owner to like check boxes of like when to do Librela, what would be on that checklist?
Ooh, that's a great question. So let me make sure I heard it right. Like what would I do as a mental checklist if I were going to recommend Librela to a patient?
Yes,
Is
like
that
how
it?
would you walk through an owner to be like, okay, your pet has this, this, and this. It's probably time for Librela.
I love that question. What a good one. So you're like putting my feet to the fire. What would I do? I love that.
Just like
Uh,
advice maybe on future vets or baby vets or
Oh, I love that because communication, I like to think I was a good vet when it came to the medicine, but I always knew where you earned the respect and the trust of a pet caretaker was when you could communicate well with them.
Mhm.
So I think it's so important.
True that.
Yes. If I diagnosed a pet with osteoarthritis, first and foremost, I would have a conversation that centered around the pain that the pet was feeling. Because I think if we don't express to our pet parents that their pet is actually experiencing discomfort, there's no imperative to treat. There's no imperative to intervene. Pet owners tell us over and over again what they value most is quality of life, and a life spent in pain is not of high quality. So I would start by sharing that osteoarthritis is a painful and incurable condition, but it is something that we have treatments that can impact and improve quality of life for that pet. And then if I chose Librela as, my recommended therapy, I would share the basics of the product. Librela is for the control of OA pain in your dog. One of the advantages of Librela is that it's administered by me here in the veterinary hospital. So you don't have to worry about dosing your pet once a day or twice a
Mhm.
day. We're going to do this once a month. And we would talk about what to expect. So some pets can experience an improvement within the first 7 days, but I typically set them up like, let's lower the expectations. Some pets don't see an improvement until after the second injection. So I'd have the conversation, again, that communication piece. We may see an improvement early, but I want to stick with this for at least 2 injections so we can see what benefit your pet is going to have. And then I would there is something called the client information sheet that is given to the vet practice with every dose of Librela. I would physically provide that client information sheet, allow the pet owner to read it. And I would say, while adverse events or side effects with Librela are rare, some can occur. And if any of the following adverse events occur, or anything that is out of the ordinary for your pet, I want you to call me right away. And that client information sheet, if you're not familiar with it, it is available at LibrelaVetTeam.com, Librela.com. It comes in the box of Librela. We make sure that you get it. But that can be handed directly to the pet owner, and it's written in plain language so that they can understand. So let's see, I've covered the need for the treatment. I've covered what the treatment is. I've covered expectation. And then I've covered, what to expect if something isn't going well for your pet. And I think that pretty much covers it. What have I left out? Dr. King, you're a wizard at this stuff. What would you add to that?
I would, I don't know, but I was going to ask the question, advise everyone on if you're starting a dog on Librela who's currently on an NSAID. What would how would you, like,
Yeah.
I know what we do, or what a lot of us do, but what would you recommend for a dog who's currently taking an NSAID? You want to switch them to Librela. What do you do with the NSAID?
That's a great question. I just so happen to have my N of 1 own personal patient that I did this with. I can tell you exactly what I did, and then I'll tell you what Zoetis, what I can share with you from a data perspective. So, actually, let me start with the data perspective. We did a 2-week co-administration study with Librela and carprofen in healthy beagle dogs. They got both medications, and there were no significant adverse events. However, it was a 2-week study in healthy beagle dogs. I don't have longer-term data to share with you. So co-administration of nonsteroidals and Librela, that's the data we have. What I did with my own dog, who was on carprofen each and every day of his life for a long time before Librela came on the scene, I kept him on carprofen, or branded Rimadyl, to be specific, for 2 weeks, and then I stopped and I watched him. And he did well on Librela, and he's on his 24th injection now, still on Librela every single month. So I did that 2-week overlap. There is no standard prescription for that. But what another kind of interesting statistic I can share with you is in the EU, where we have a longer period of Librela use, it's 75% of Librela patients, that's the only analgesic that they're on. It's not that they're not doing other multimodal therapy, but the majority of dogs are controlled on Librela, 75% of them. So, Dr. King, is that close to what you do with your patients? I'm
Yeah,
curious.
pretty much. Yeah, like sometimes I'll take them out and then drop them down to once a day if they were on twice a day, and then
I
take
do
them
kind
off.
of a taper. It just kind of depends on the degree of change I can palpate, like actually feel on exam, versus do we have x-rays that I can go off of at that as well to know the degree, only because I do sometimes get caught up in those really severe cases. It sometimes takes the 2 injections. So my fear would be is I leave them too early without the full 100% or close to 100% efficacy. So,
Mhm.
Yeah.
Yeah, I'm with you on that one. I'm really sensitive about those periods of uncontrolled pain because we
Mhm.
know that that's when the nervous system winds up. And fortunately, we can actually have a positive improvement on the nervous system when we control pain, in that it can return to a more relaxed state, a less sensitized state. But allowing a pet to be in pain is certainly something that leaves me with some anxiety. And, if I may, I actually, we know that pet owners, or you probably all know, we're notoriously bad at compliance, even
Yeah.
veterinarians. So, one of the things that I think really shines about Librela, and why I really enjoy not only being a pet owner that uses Librela, but a veterinarian sort of championing it in the real world, is that it provides that consistent pain relief. And we
Mhm.
know that pet owners give nonsteroidals as needed. They
Mhm.
really do. And
Mhm.
veterinarians, a lot of us prescribe them as needed. And as needed for chronic pain is frankly not enough. So Librela offers that sustained um, pain relief that our pets in chronic pain, I think, so desperately need.
Yeah, absolutely.
Yeah.
Especially when we're the only ones finding
I know.
it.
Right.
Like, your
I
animals
know,
really
right?
need something.
I want to go back to Courtney's question because I want to make sure that we got it correctly. I think you were looking for things that we might see in a patient that would cause us to use Librela, or did
Oh,
your
yeah.
question get answered?
I think it definitely answered like how to talk to like through a
Mhm.
client, like, okay, this is why your pet needs Librela, this is how it works, blah, blah, blah. But I think it would also be helpful, like that what I meant by the checklist was like if you're seeing this, this, and this at home, and then we're seeing this, this, and this on exam, that's why
That
we
should
then
be
need
why
to
we would
start
talk about
Librela.
Librela.
Yeah.
No. Yeah. Oh, I love that question too. I answered the one I wanted to answer. Now
No,
let's
that it was
continue the
it's all helpful information. You haven't said one thing that has not been helpful. So I
no,
was good with it.
that's such a good question too. I would love for your audience, your veterinary audience, to visit librelavetteam.com for the dog OA checklist, because it's literally a checklist.
Wow.
And what I mean by that is that there is actually some solid research that owner assessments can be very accurate in detecting OA pain. So there's this really amazing, like, easy pictorial checklist that they can use, and essentially, they check in the affirmative if the dog is lagging behind on walks, struggling to go up the stairs, having difficulty, jumping in and out of places. There's, I think, 6 behaviors. And that is literally the checklist I would have pet owners fill out. And if they check any of those in the affirmative, it raises our index of suspicion. So if they have a positive on that checklist, then what I'm looking for in my physical exam is crepitus, which I think somebody, crunchy joints, like you almost cringe when you feel it, decreased range of motion, inflammation, so actually heat or swelling around a joint, and pain, of course, if a pet is resisting flexion or extension, which I think we can sometimes demonstrate that within reason to our pet owners as we're doing a physical exam. I often look at the pet owner, I go, okay, watch him. When I do this with his hip, he's going to look at me. And that's him telling me that hurt. And when you explain that language to pet owners and say, he's not going to cry, he's too polite to do that. He's too
Yeah.
polite to bite me. You have such a great dog. He's not going to, not going to bite my face off, but don't let that fool you. He's in pain. And then, so those are the things I'm going to feel on physical examination. And then I'm going to watch them walk. So doing lameness evaluation is critical, and I think it's a step a lot of us overlook for very valid reasons, like we don't always have the space, for this tiny exam room. But getting a dog outside and watching them walk, looking for differences in gait, particularly, bunny hopping or a stiff, stilted gait where they just don't want to do that full range of motion. Those are things I'd be looking to check off. And then, x-rays are always wonderful. They don't always happen, but it's certainly part of the baseline workup for osteoarthritis. But those are my checks, a literal checklist and then my
Yeah.
mental checklist in the physical exam.
I will say, I think I use definitely more for the feline patients, the checklist for the Silencia and the cats and
I
arthritis.
love that video that you
Oh,
can get that video, the one that shows all the
yes.
cat. It's my
Basically,
favorite.
any older cat, I'm putting it on the
Yep.
email summary or the exam note because it's the best way I can explain. Go look at these cartoon pictures and then tell me if that's what you're noticing. So I think it's such a huge game changer. And it kind of gives me a little bit of I don't know,
It's
relief,
like
trust.
Well, and
like,
I was gonna say it's like affirmation that you're not crazy, right?
yes.
Like if they can come
Yes.
to the conclusion, it's kind of like soft selling. If they can
Yes.
come
Yeah.
to the conclusion themselves,
And you're not like feeding it to them
yeah,
necessarily, and they're
so it's
physically
like
seeing the
they're
changes.
part of the decision making.
Yeah.
If you know,
Especially a cat
Yeah.
in the clinic.
Yeah.
But no, that's
Yeah.
so helpful with canines as well, especially if you're hitting that wall with those owners that don't seem to grasp but see, acknowledge the changes that we can so easily see because they're with them every day. I get it. Like they
Yeah.
don't see the subtle things.
Right.
So
And I think it's maybe an important note, possibly for our newer graduates, that you don't always get to a yes in the first exam or the first time you meet a pet owner, but that doesn't mean you haven't made a difference. You've possibly planted a seed, you've given them homework, you've given them something to think about. And I have seen so many times where they come back and go, now that I'm really taking a critical look at it, I do think my pet's in pain. So there can be this feeling of failure if you don't convince an owner in that first visit of what you found on physical exam. But I would urge, all of us not to give up. We're still making a difference if we sway or we push that owner gently towards what is reality. Sometimes they don't like to be shoved.
yeah, right.
That's
That
true.
is for sure.
Yeah.
You'd hope after every year of saying the same thing it would eventually hit, but
Yeah, you would hope.
I think another big I guess thing to clarify or let veterinarians know out there, like if you have an owner calling saying, we gave my dog Librela and now I'm seeing this, this, and this, what is the process a veterinarian should go through to deal with that, report that, things like that?
Mhm. It's a really important question. And again, I'm going to raise my hand and admit some things I did in practice that now I know I could have done a little differently. And that is that if a pet owner reports a suspected, it doesn't even have to be proven, adverse event following the administration of Librela or any product, a veterinarian can, and I don't like the word should, but we are actually compelled, should report that to the appropriate regulatory body or manufacturer. So if a pet owner reports that to you, first step, of course, is to make sure the patient is cared for and do the things that you need to do. But then you can either report directly to the FDA if you are in the United States, or you can report directly to Zoetis, and that's called an adverse event report. You need 4 things. It's patient, product, problem, person. So I'm always like, oh, panic, don't miss the 4th one. It's the person, it's the patient, it's the product, and the problem. And that's all you need. So you could not have a lot of detail, and that doesn't matter. You can call Zoetis, you can visit the website to make an adverse event report, but that's what should happen after that event is reported. And we take all of those reports seriously. We then report them on to the FDA and to appropriate regulatory agencies, and it's part of that post-approval safety monitoring process. So it's pretty simple, but it's the stuff that I have to admit sometimes you overlook. Like, when was the last time you reported diarrhea with a non-steroidal anti-inflammatory?
Right.
probably haven't done that in a while. Yeah.
Yeah.
I just tell them to watch out for.
Yeah, right?
It can't
But,
cause Jerry upset. Call us if it happens.
Yeah.
it happened. But it's actually a really important point. And to go back to like, why is Librela getting a lot of attention? It's because it's new. It's a new and innovative therapy. And it is the case that in the first couple years of a product's life in the market and in use in patients, we as practitioners and pet parents are more likely to report an adverse event. It even has a name. It's called the Weber effect. In the first couple years, you see adverse event reports peak, and then they level off as we develop a clinical sense of how these products operate in our patients, what we can expect, what we just warn the owner. But it's a well-documented phenomenon. So that might also answer your question about why is Librela getting a lot of attention. It's because it's a new and innovative therapy. It's an entirely new class of medication. And, adoption is not a straight line. There's some bumps sometimes.
Yep, absolutely.
Why do you think in Europe they're using it in such a younger patient population? How did that happen for them and not for us here in the United States?
I might not have an answer to this question. I usually have an answer. And I spent a little time in the EU. One of the things that I feel really fortunate about my job is I get to talk to veterinarians worldwide. I got to travel to the UK last year for that very reason. And I don't think the vets there are terribly different than us, but they adopted Librela and Solensia early, and they used it in a variety of patients. It may be a difference in culturally and what pet owners will and won't do as it's recommended to them by the veterinarian. I think that's a potential, but it is the case that veterinarians in the EU or overseas had a slightly different experience with the launch of Librela. At the risk of diving into an area that is not my expertise, I think social media, the internet, is a little more front and center in the American culture than in some other countries. So it's not directly related to your question, but just a little bit of a difference in the experience between the two countries. So I don't I don't know that I have an answer for you, Dr. King.
Yeah. I know, like at our practice, like we created a list of like all the patients that we were like, we're going to keep them from dying if we can get them Librela, So I feel like to some degree, like, okay, we pigeonholed it, right? For this particular set of patients and didn't even take into account. Now we do, but I mean, like previously take into account those patients with mild or moderate disease because it just wasn't like we were just like all in for like
the
saving.
patients that could walk and they were on 17,000 different oral meds a day.
Yes, exactly. Yeah.
You bring up a really good point, which is that when we evaluate that post-approval data, again, we see that the demographics of patients experiencing an adverse event with Librela skew really far into the geriatric range, so that it's somewhere around 70% of the patients were older than 12 years of age. So exactly what you said. Everyone called up the ones that had one paw on the grave. They were like, we got it. And that's and they were also reported to be in fair condition by and large, so not great condition. So we are talking about a population of pets that just are polypharmacy, comorbidities. They're a complex group of patients that we're treating, and we're adding that therapy. And I think it's really common for us. It's like, last in, first out. That's what we look at. So I think it's a really important consideration. And my hope, and really a lot of the work that I do at Zoetis, is around educating veterinarians. I'm really proud of the ability that I have, or that we have at Zoetis, to sponsor medical education to really bring the standard of care up across the board for earlier diagnosis, earlier intervention. That's the good stuff. Like I love that we get to support veterinarians in their educational journey, and it's not always easy to diagnose OA. So being able to provide some of those tools and resources to help support veterinarians is awesome.
Yeah, that's what that was kind of the question I was going to go into, is the data speaks for itself, right? So providing data for everyone to just do their own research, talk to, answer those questions with backed research. But what other things does Zoetis try to do to just address these concerns that are out there? Whether it aids veterinarians to have like you had mentioned, resources, right? So there's a lot of educational content, whether it's a website, a handout. Are there any other things that Zoetis has tried to do with this Librela discussion?
Yeah, a lot. So a lot to share there, and a lot that I I'm proud of that we do at Zoetis. So first and foremost is medical education for veterinarians. Dr. King, I don't want to like let a cat out of a bag, but she is one of our partners when it comes to medical education for veterinarians. So we do that both at major conferences, trade shows, virtually on demand, anything you can think of when it comes to continuing education, and we do it. So medical education is a huge focus because when we better understand the disease state, we can better treat and manage our patients. Is second thing that we are fully invested in is research. So both pre-approval research, post-approval research, both directly related to our product and related to disease state itself. As I mentioned, better understanding what does normal progression of osteoarthritis look like. That's just one study amongst many that we are sponsoring. And then, I would say lastly, but certainly not all inclusively, we pay very close attention to the safety profile of products that are in the market and continue to investigate both, as I mentioned, with internal specialists, external experts in the field of veterinary orthopedics, veterinary neurology, to help better understand the safety profile and the efficacy profile of our products. I'll just give one example post-approval of Librela. There was a study in the UK done by Dr. John Innes, who is one of the foremost researchers in the space of osteoarthritis pain. And he did a head-to-head comparison of Librela and meloxicam, which is the most commonly used nonsteroidal product in the UK. They love their meloxicam. We love our Rimadyl. It's like an Olympic battle. But nonetheless, he did a head-to-head comparison of Librela and meloxicam. And what he found is that they were equally efficacious and for the most part, well tolerated, both products. Though not statistically significant, it was of interest that there were actually more adverse events in the meloxicam group than the Librela group. So just adding to that body of knowledge around osteoarthritis and osteoarthritis pain relief. So education, knowledge around safety, and future research or constant research. That those are some of the things that we are doing, and veterinary podcasts, which is a new
That's right.
a new and exciting thing that we're doing.
Yes.
Got to get those young people. They're all out there
That's
listening to the podcast.
I know.
Oh, gosh.
Wow. My brain is so stuffed with information.
It's
I just
fantastic.
think it's so helpful
Yeah.
to just have a frank, open, honest conversation, but with also data and just, I don't know. I just think it's what we need right now in just such a universal internet
Kick
opinionated
fear-mongering in
world.
the butt.
What's
Yeah.
that?
Fear-mongering. Kick it in the butt.
Yeah. I mean, it's like, people at the end of the day are still going to do what they want to do.
Right.
But if you have all the information out there, what more can you do other than offer it? So I think this is another great way to do it.
Yeah, and
absolutely.
if I may, this is certainly not a data point. I referenced my own pet, but I want to say a little more because I think it speaks to we can get overwhelmed with negative information in this space and many other spaces. But it remains the case that the majority of pet owners that we actually ask about their experience with Librela, 75% report that they have had a good or very good experience with Librela. So I think that's the silent majority we're not hearing from. And I include my own pet in that group. So I referenced that young dogs get osteoarthritis. My own dog was to be honest, I knew there was something wrong when he was 9 months old. I did a
Wow.
pen hip evaluation on him, and I can only report his hips as a hot mess. I think that was the official term.
Oh
That hot
no.
mess. This dog is going to have osteoarthritis. And sure enough, by age 4, he's a little beagle mix. He was growling at my children. And it was scary, and I realized that even though I'm a veterinarian, I have a passion for pain management, I was looking at this 4-year-old dog saying, "He's too young, like, he's too young to be on daily pain medication," and he wasn't, and I was able to start him on daily I did finally wake up and start him on daily Rimadyl, and I did that for almost 3 years until Librela was approved, and now he's been on Librela for coming up on 2 years, and he is only 8 years old. So
Wow.
Yeah.
he is a really profound he is a teacher for me and has been a game changer to look early, not to ignore signs of pain. And then frankly, Librela has been an amazing therapy for him, not only because it really keeps him comfortable, but because I don't have to worry about it for 30 days at a
Yes.
time.
Yep. Amen.
So
Yeah.
woo,
Exactly.
the compliance. And I was good with compliance with his Rimadyl, but only because I knew it was the difference between him being a happy, healthy member of our family and maybe getting in a situation that would be challenging with, with our young children. So I
Absolutely.
just want to share that story. He's one of those 75. I'm one of the 75% of pet
There
owners
you go.
that are
There you go.
extremely or very satisfied. So
They always seem to find the pets always seem to find the right people though
That's
that
right.
in
Exactly.
some way will teach us something. So
yeah.
okay.
Anybody have any remaining questions?
I don't think so.
Okay.
I think
Thank
she
you
got it
so
all.
much
Yes,
for your
thank you so
time, Dr.
much.
Yes.
Shears. Very
You are
helpful.
welcome. Thank
Yes.
you all so much for doing this. What an amazing service to the veterinary profession that you all provide. I'm really impressed and just so honored to be a small part of it. So thanks for making time for me. And I look forward to hearing this in my ears.
Yeah.
What
Thank
a
you for
cool
the
thing.
compliment.
Well, now we'll be
Yeah.
able to reference it. We'll be like, hey, go check that out.
Yes.
I'll just, if
Yeah.
owners
You wanna
ask me
know
about it, I'll be
more?
like, here's this episode, just go
Exactly.
listen to it.
Exactly.
All the
Absolutely.
information you need.
Exactly.
Love it. Yeah, thank you
All
for the
right.
opportunity. All right.
Thank you so much for tuning in to another episode of the Veterinary Roundtable. Remember, send in those questions and leave us a review if you enjoyed this episode or a previous one. We'll see you next week for another episode of the Veterinary Roundtable.
See you next time.